have an open discussion on the topic, the fat fight. This is going to be the agenda for our day. So, before we get into the big fat fight discussion, I would like to tell you all a little bit about Kiran Derma Search. You must be aware of the fact that today the entire market is flooded with n number of cosmetic procedures. But the only concern and issue which comes to our mind is like whether these procedures they're beneficial or not, whether they're going to give us the desirable results or not. So keeping that in mind, we at Kiran Derma Search, we basically cater to only the highest level of medically proven cosmetological procedures. We just, promote those procedures. I'll tell you something about our founder. This is Dr. Kiran Dhar. She is one of the most renowned founder who has been practicing in clinical medicine for more than 25 years. We have kept it in mind to, keep on incorporating her principles and goals in our organization, be it any of our clinic, to keep the interest of the patient's skin health in our mind. Kiran Derma Search began with its journey in 2006 with our first clinic in Dubai, following our second clinic in Gurgaon, and recently we have collaborated with Max Hospital Group and we've started our own aesthetic center over there. This is our amazing team of doctors. As you can see, I would request you all to take a little bit of time, out of your busy schedule and visit their profiles on our website, And this is about Dr. Pooja Agarwal. Now I would like to invite her to, begin with the discussion. She has been working in the field of dermatology for more than 7 years. Dr. Pooja Agarwal, kindly begin with the fat fight discussion.
Good evening, everyone. Thanks, Nupur.
You're welcome.
Okay, now we'll begin our discussion on fat fight. Can you really reshape your body? Whenever we talk about weight or reshaping the body, BMI is the first thing that comes to our mind. It is a global method of determining overweight or obesity. Now, this is a classification based on BMI. When the BMI is more than 25, it's called overweight, and more than or equal to 30 is obesity. But the question is, does BMI tell us the entire story? Is it too overrated? No, there are a lot of individuals who appear thin, who look apparently healthy, but they can have higher fat content inside the body. This phenomenon is known as normal weight obesity. These individuals have the same health hazards as any overweight or obese individual would have. For example, heart disease, diabetes, stroke, raised cholesterol and hypertension. Also, large waist circumference in adulthood is associated with heart disease and type 2 DM. See, at Kiran Derma Search, what we do is, we do a complete body composition analysis using a bioelectrical impedance. Now here we can see this is how the report is generated. The weight is there, you get fat percentage, there is fat mass in kgs, then you have fat-free mass which is composed of blood, water, muscles, bones, brain and all other organs. Then and also it gives us an idea about the basal metabolic rate. So thus we do a complete analysis and then we guide you further on maintaining a healthy lifestyle. Now, what is the goal of today's discussion? We are not going to discuss about weight loss per se. What we are going to discuss about is inch loss or circumferential loss. And there are individuals who are thin but there are stubborn areas of fat in certain areas. For example, the waistline or maybe the lower back. Some people who could have a heavy arm or heavy thighs. So that is the goal today. Now, as we can see, this is another condition that we would be targeting today. This is cellulite. Whenever you see such irregularity or dimpling of the skin, this is called cellulite. Now, cellulite is a very common condition. It affects almost 80 to 90% of the female past their puberty, which means that even thin individuals can have cellulite. It is not a condition affecting the overweight individuals. Now, anatomically, this is how cellulite looks like. See, there are these fibrous bands which attach the skin to the underlying fascia and there are fat cells in between. What happens is, these fat cells increase in size due to various reasons. They push the skin up while the band, they pull the skin down. This leads to dimpling of the skin. Next condition, a very common thing, double chin. This is due to accumulation of fat in the submental area and this leads to the appearance of a second chin behind the actual chin. Now these are some celebrities who have double chin. what are the causes of cellulite and weight gain before we go into the treatment? See, hormones is the most commonly implicated thing. Estrogen is the most common culprit. There are other hormones like insulin, thyroid hormones, prolactin, which are also implicated. There is always a genetic susceptibility to cellulite development and also weight gain. There can be some racial differences. As I already mentioned there is a gender inequality, which means female are more susceptible to cellulite formation. Now, lifestyle. These days we follow a very sedentary lifestyle. We go to work through car, we sit in the office most of the times and in front of the computers. We come back. As a mode of entertainment, we might go and watch a television, a movie, or sit in front of the TV. So this lifestyle tend to put on more weight and cellulite formation. Fat diets. There are a lot of diet programs available which say they can reduce your weight, say 5 kgs in a week or so. These diets are actually detrimental to health. So they also promote cellulite formation. Unhealthy eating habits. We try to find over-the-counter, easily available foods all the time. So again, but they have more processed carbohydrate, which tend to put on weight and promote cellulite formation. Now, what are the treatment options? Before we go to what we follow, I'm just putting what are the options that we have. Weight loss, obviously, through a healthy diet and exercise is the most important factor. It is the most beneficial thing. But does it help entirely? Even you might lose weight, but then you might have fat in some areas of the body. Then you need to add on another treatment. Again, cellulite, you might lose weight, your cellulite will reduce, but again, it will not go away completely. There are a lot of creams marketed as a cure of cellulite. They would contain some antioxidants, herbal extracts. Now, do they actually work? We do not know. Vigorous massage through increasing the blood circulation and heating the tissue can help in reduction of cellulite. The most promising system of treatment is lasers, radiofrequency systems, and mesotherapy that we will be discussing shortly. Many people would go for liposuction, which is recommended ideally for reshaping the body, but it would not help in cellulite reduction per se. Now, this is what we follow at Kiran Massage. We do an holistic analysis and then we target different modalities at a single time. So we go for non-surgical body contouring along with diet and exercise. Non-surgical body contouring has vela shape and mesotherapy. We would not be talking about again diet and exercise because that's an entirely different domain. It's so important, but again we require a separate discussion for that. Now, non-surgical body contouring via vela shape. See, it is an FDA and CE cleared machine for cellulite and circumferential reduction. It helps in reshaping the body. It is a painless, non-surgical and safe treatment, and it is effective on all skin types and colors. This is the machine that we use. It has two applicators. As we can see, V contour and V smooth applicator. V contour is for smaller areas, whereas V smooth is for larger body surface areas. Now, what is the technology? It combines three technology known as bipolar radiofrequency. We are all aware it's a very high technology right now. Infrared rays and vacuum. Now, the advantage with vela shape is it has combined radiofrequency and infrared in one machine, leading to an electro-optical synergy. It's a patented technology only with this machine. Now, what it basically does is it heats up the tissue. So infrared light would heat up to the deep dermis, whereas the radio frequency will go below to the fat layer. So because of infrared, there will be increased collagen formation, leading to tightening of the skin, whereas the radio frequency will break down the fat cells, shrink the fat cells, and thereby reduce your fats per se. Now, what happens with vacuum is it will pull the skin up. Under physiological conditions, about 80 to 90% of the blood vessels are compressed. Now, when the skin is pulled up, these vessels open up, and there is increased blood circulation in that area. Also, because of the blood circulation, the raised temperature with infrared and radio frequency will also sustain. The larger applicator is provided with two rollers. The purpose of these rollers are that they can have a mechanical massage effect that can help to drain down the excess fluid and the toxins to the nearby lymphatics. Now, we have just listed the general contraindications and specific contraindications for vela shape. Now this is the second domain in non-surgical body contouring, known as mesotherapy or injection lipolysis. See, this technology was initially conceived in Europe. It was originally used for treatment of pain, but now it is being used in cosmetic dermatology. Now what is done is a cocktail of medication is injected directly into the fat layer through multiple tiny injections. See, this is what we see. There are fat cells. The material is injected into the fat layer. The fat cells, they get inflamed and they break down, and then they are drained out of the body through lymphatics. These are the treatment areas that can be targeted through non-surgical body contouring. So we have lower abdomen, upper abdomen, lower abdomen, inner thighs, outer thighs, knees, then neck, double chin, upper back, lower back. This is also known as love handles. Then you have buttocks, then back of the thigh, arms, and male breast. Now I will show you some pictures so that we can have an idea as to how it works again. See, this is a male client. The abdominal girth have reduced after 3 treatments. We can see there is reduction of fat in this area, and the outline of muscles have become better in the collar. This is a female patient who has a major bulge on her lower abdomen, and this is after 6 treatments. See, the bulge is not much as compared to the previous patient, but she required more sessions than him. That is because there is always an individual variation. This is another picture where we can see there is reduction in the abdominal girth considerably. Now see, there is not much change in weight, so that's why I am focusing that the purpose of this treatment is not to lose weight; it is to lose inches. Okay. Now these are lower abdomen, or we call them as love handles. Now you can see the fat in this area have reduced. Double chin. See, now there is reduction of fat in the submental area below the chin, and also there is tightening of the skin. We can see, it's much better defined now. This is another picture of double chin. There is reduction of fat in this area. Now see, in this patient, the inner thighs were treated. Now when the picture was taken, the legs have been placed in equal distance, so that we can understand it. Now here the thighs are almost touching each other, but there is increase in the gap. So there is reduction of fat in this area. Now this is for skin tightening. You see the skin appears pretty wrinkly here, but after 4 treatments, the skin is pretty tight now. A very common question that we get in dermatology: are the results permanent? वापस तो नहीं आएगा, अब पक्का चला जाएगा. That is a question that we would always have. See, according to the current state of knowledge, the fat cells that have been dissolved would not return. So if the weight remains unchanged, if you follow a good diet, and if you do some sort of physical activity, the results of lipolysis should remain constant. Something like liposuction, as it is said. But the advantage of these treatments are gentle, they are pain-free, they are low in risk, and it doesn't take long. You can, even if you go to office, you can come during the lunchtime, get the process done, and then you can go back. The ability to work is also not impaired, so there is no downtime per se. So this is the package that we have. At the initial consultation, we give you a diet counseling. We understand what is the lifestyle we follow now, and then based upon that, we give you a better modification of that lifestyle, and we do a total body analysis. Then 4 fellowship and 1 mesotherapy is done in first month, 3 fellowship and 1 mesotherapy in second month, and again as a maintenance, 1 fellowship and 1 mesotherapy and 1 diet counseling in third month. Similarly, we have packages for arms, double chin, buttocks, thighs, or any other areas. Thank you. Now we are open to questions. Something.
How do these treatments help in water retention?
See, again, water retention, because fellowship. See, mesotherapy per se will not help in water retention. It has no role with it. But with fellowship, because of that, overall water retention no. But because of that effect of rollers, cells के बीच में जो edema होता है, that can definitely go reduce. But if you are talking about if you have water retention, your symptoms are you tend to have swollen hands and feet, या फिर under eye bags होता है, इसमें the treatment will not help.
So it helps only in the abdomen area.
Yeah, see, would not target, जो जिनका body mass index, I will say commonly जो हमें पता है, who have say double है या फिर 30 to 40% higher है, then they would require other modes of treatment. But somebody who is relatively healthy but have those stubborn areas, then for those individuals it would be much more.
What other modes of treatment?
See, for example, if your BMI is more than 40%, अगर आप fat percentage बहुत ज़्यादा है, then bariatric surgery is recommended. When it is lesser than that, then you go for liposuction.
No, I'm talking only of water retention.
For water retention, okay, water retention, what you need to do is you have to cut down your salt intake in the diet, right?
But you don't have any procedure for that.
No, there is no procedure for that. There is no procedure that can be done for water retention. Questions?
What is phototherapy for psoriasis?
See, in phototherapy, what happens is what we use is narrow band UVB. Okay,
What is UVB?
ultraviolet B light. Okay, so it is a very narrow band of light which, when targeted onto the skin, would help in reverting back the processes that is causing psoriasis.
Okay. Irrespective of the age?
Irrespective
Of the
age.
span of this disease?
Absolutely. See, again, it's not one session.
No.
Yeah, you require multiple sessions.
Oh,
Actually,
absolutely.
every
But
alternative.
it depends on the location of that psoriasis.
Exactly. Anything else?
No questions? Thank you so much for your patience. Now I think, you sure nobody has any other question? Anything related to skin or hair? Anything?
Any other
Because we
subject?
are into skin health and hair health as well.
What do you recommend for hair health? Suppose one doesn't want to go in for hair coloring,
Okay.
and because of these chemical content involved.
Okay.
So how do you do normal coloring? So everybody says, okay, go in for a hair color. I don't want to go in for hair color. So what are the alternatives? Because everybody has a different problem. I have limp hair. I have a problem of hair loss, but that I have controlled. But I cannot regain the black color. So what are the choices?
See, it is said, once your hair has turned grey, the chances of it going back to black is very minimal, because the cells at the root have been destroyed, right? So first thing we look at prevention of graying of the hair, because of aging, some amount of graying would happen.
No, that is genetics.
That is genetic.
Definitely.
So
I cannot
prevention-
question that. yeah.
Exactly. Prevention of graying of the hair, you have to increase the antioxidant content in the diet, right? Because of the
That
lack
I'm
of-
doing.
Yeah, so that is
I'm
one-
very that way I'm very careful.
Yeah, so the second thing is you can take specific hair vitamins, that may help in preventing of graying of the hair, right? And apart from that, in general, just to have better hair, the protein diet in
That
your
is it.
diet should be.
Yeah, high protein
These are the
diet.
three things actually.
Okay, then I would like to invite you all to take a tour of a clinic upstairs and get your body mass index checked. We have snacks plus as well, we have Covermark products as well. If anybody wants to know anything about these products, you're welcome to come and